Triage. We are going through this issue of JAVMA from May 2014. We're going to be talking about this paper here, the efficacy of orally administered maropitant citrate in preventing vomiting associated with hydromorphone administration in dogs. The study comes out of Iowa State University Vet School. It is supported by Pfizer Animal Health. Let's go through it. The objective is to evaluate the effectiveness of orally administered maropitant citrate in preventing vomiting after hydromorphone hydrochloride administration in dogs. In the picture below here, you can see different signs of nausea in animals. I'm not sure diarrhea is one of them, but these are all valid signs of nausea. And maropitant is a drug that we use to prevent nausea and vomiting in animals. Hydromorphone is a synthetic morphine derivative. The design of the study is randomized, blinded, prospective. 40 dogs with the American Society of Anesthesiology status 1 or 2. There's 5 statuses, 5 being the most severe, and it plays into how big of a anesthetic risk that patient is. 1 or 2 is the lowest risk. These dogs are over 6 months of age. They weigh between 24 and 58.2 kilograms. Right away, you can tell there's not enough dogs, 40 dogs. I mean, I don't know what the magic number is, but you want more than 40, or you want as large number as possible, I should say. The age, being over 6 months old, is great. However, we don't know what the effects of this study will be in under 6 months. And the size of dogs also. We don't know how this will affect dogs that are less than 24 pounds or kilograms rather, or greater than 58.2 kilograms. Procedure, maropitant was given at 2 to 4 mg per kg, or 0.9 to 1.8 mg per pound. Again, why is there a range for maropitant? Why isn't it a standard dose? Or they were given placebo, which is lactose monohydrate, orally 2 hours prior to receiving hydromorphone at 0.1 mg per kg or 0.045 mg per pound intramuscular. So we don't know what the effects of maropitant given any other way other than orally will be. We also know hydromorphone, whether it's given subcutaneous or IV, if that matters as well. But that's why these studies are difficult, because there's lots of variabilities. Results of the 20 dogs receiving maropitant, none of them vomited, but 60% showed signs of nausea. Nausea signs are subjective, and so that is a subjective finding there. Of the 20 dogs receiving placebo, 25% vomited and 55% developed nausea. Overall, 80% of dogs in the placebo treatment group vomited or developed signs of nausea. Compared with a placebo, maropitant significantly decreased the incidence of vomiting, but not nausea. Conclusion was that among the 40 study dogs, the incidence of vomiting associated with hydromorphone was 25%. Oral administration of maropitant prevents vomiting, but not nausea. All right. Discussion. Hydromorphone is a synthetic mu-opioid receptor agonist that is 5 to 7 times as potent as morphine. It is commonly used as anesthetic pre-medication agent alone or in combination with tranquilizers or sedatives as part of a regimen for induction of anesthesia in higher risk patients and as intraoperative and postoperative analgesia. The versatility as well as the avoidance of histamine-mediated vasodilation and hypotension and the drug's low cost contributes to its widespread use. Morphine is known as one of the side effects is known to cause histamine release from mast cells. So the chance of having allergic reaction to morphine is high, and that's why these synthetic morphine derivatives have been developed. Adverse effects include respiratory depression, bradycardia, behavior change, including sedation, dysphoria, excitement, urinary retention, decreased urine production, and gastrointestinal, including salivation, nausea, vomiting, defecation. In dogs, the incidence of vomiting associated with hydromorphone is between 0 and 100%. In general, the incidence of vomiting is decreased with higher doses and IV administration of hydromorphone. It's also decreased with concurrent administration of acepromazine, and it's decreased in purpose-bred or research-conditioned dogs from which food had not been withheld versus clinical patients undergoing elective surgery. Brachycephalic breeds are at increased risk of peri-anesthesia vomiting, regurg, aspiration, pneumonia, and increased mortality rate. Vomiting may also be undesirable in certain clinical cases wherein increases in intraarticular or intracranial pressure caused by vomiting can lead to increased morbidity. Maropitant is a neurokinin 1 receptor antagonist preventing vomiting secondary to a broad spectrum of emetic stimuli, including cisplatin, which is chemotherapy, apomorphone, which is a drug that we use to induce vomiting, like if a dog eats something they shouldn't have, copper sulfate, and motion sickness. Subcutaneous injection of maropitant is associated with pain, especially when it's been stored according to label instructions at room temperature, 20 degrees to 25 degrees Celsius. Intravenous administration of maropitant is extra label and has been associated with hypotension in dogs and cats. Materials and methods. Status 1 anesthesia risk are animals that are healthy with no systemic disease. Status 2 have non-incapacitating systemic disease. I don't know why they couldn't make this study all about status 1 or all status 2, just keep it the same. Oral dosing for maropitant for dogs that refuse the capsule or capsules and food were administered the capsule or capsules by hand without food. So some dogs received it without food, some with. Again, why have that variable? Just keep it all the same. Dogs were administered maropitant or placebo 2 hours before receiving hydromorphone at 1 mg per kg intramuscular in the lumbar epaxial muscles. And again, 2 hours prior, we don't know what the effects will be longer or shorter than that, but just being open-minded about it. It's hard to control these things in these studies. You have to start somewhere. Signs interpreted as nausea include salivation, increased frequency of or exaggerated swallowing, lip licking. They were subjectively graded as none, mild, moderate, or severe. The maximum severity of signs of nausea noted during the 30-minute period was recorded for each dog. So 30 minutes, so we don't have any information beyond the 30 minutes. Among the 20 placebo-treated dogs, 25% vomited and 80% had nausea. In the maropitant treatment group, none of the dogs vomited, 60% had nausea. Orally administered maropitant significantly decreased vomiting, but not nausea, compared with placebo. All right, discussion. The results of the present study indicate that the oral formulation of maropitant given at a minimum dose of 2 mg per kg orally for the prevention of acute vomiting was effective in preventing vomiting in dogs receiving hydromorphone at 0.1 mg per kg intramuscular. Subcutaneous injection of maropitant is because the drug solution is formulated with sulfobutyl ether cyclodextrin, with which maropitant forms a molecular complex that provides higher drug solubility and improved injection site tolerance. At warmer temperatures, there is greater complex dissociation. It is suggested that the injectable form of maropitant should be refrigerated until administration to minimize injection reactions. Recent studies that investigated the minimum alveolar concentration sparing effects of maropitant indicate that extra-label intravenous administration may cause hypotension in dogs and cats. Oral administration of the drug avoids injection pain, the need for refrigeration, and any issues with extra-label use, plus cardiovascular adverse effects. Syrup of ipecac, which is a peripherally acting emetogen, meaning it induces vomiting in animals, and apomorphine, which is a centrally acting emetogen. In those experiments that use those meds, orally administered maropitant in dogs at a minimum dose of 2 mg per kg 1 hour prior to administration of the emetogen significantly reduced but did not eliminate vomiting. Pharmacokinetic data indicate that, and this may be why they did 2 hours before and why they had a dose range of at least 2 mg per kg or higher. Pharmacokinetic data indicate that the plasma concentration of maropitant is maximal at 1.9 hours after oral administration of a 2 mg per kg dose. Therefore, the effectiveness of maropitant in the prevention of vomiting induced by an emetogen may be increased if an interval of 2 hours is allowed to elapse between the two treatments. In a study evaluating the treatment of motion sickness in dogs, maropitant given at 8 mg per kg orally 1 hour before a car ride did not have an effect on the incidence of nausea. Hypersalivation and retching were reported as most common at 9 out of 17 dogs at 8 mg per kg of maropitant given orally 1 hour before transportation. In humans, where being female imparts a 2 to 4 fold increased risk, the strongest patient-related risk factor for perioperative nausea and vomiting. Prepubescent girls lack this increased likelihood of perioperative nausea and vomiting, which may imply the risk is related to hormonal factors. All the female dogs in the placebo treatment group in this study were spayed. Another study showed that no dogs vomited or developed signs of nausea when treated with intramuscular hydromorphone at 0.22 mg per kg alone or with acepromazine at 0.05 mg per kg. Another study showed that 5 of 10 dogs vomited when hydromorphone at 0.1 mg per kg and acepromazine at 0.05 mg per kg were administered intramuscularly at the same time, and that administration of acepromazine 15 minutes prior to hydromorphone decreased vomiting in 5 of 21 dogs, presumably due to the blockade of dopamine receptors in the chemoreceptor trigger zone. The chemoreceptor trigger zone of the CRTZ is in the brain, and it's CRTZ is in the brain and can trigger vomiting and nausea. You can also notice in these studies, these are always small numbers of dogs. You want more dogs, I think, ideally. Another study found the incidence of vomiting varied with the dose and route of administration of hydromorphone. At a dose of 0.1 mg per kg IV, vomiting was seen in 3 out of 9 dogs, whereas 6 of the 8 dogs given the same dose subcutaneously vomited. So more vomiting with subcutaneous. Following intravenous administration of 0.5 hydromorphone per kilogram to 9 dogs, none vomited, so a larger dose. However, subcutaneous administration of the same dose caused 100% vomiting. It is postulated that at a lower dose or through slower absorption, opioids reach the chemoreceptor trigger zone, but not the vomiting center, and therefore result in emesis, whereas at higher doses or IV administration, opioids reach the vomiting center and block the effects on the chemoreceptor trigger zone. In another study, only 5 of 23 dogs, which is 22%, that received hydromorphone alone or with acepromazine vomited. According to another study, two studies, it appears that lack of food withholding decreases the incidence of vomiting associated with hydromorphone. So if you give them food, you see less vomiting. The incidence of vomiting in acclimated research dogs following treatment with hydromorphone alone or with acepromazine has been reported at 0% and 22%. This current study, 40 dogs, 55% of which were client-owned and 45% were stall or student-owned. Many of the staff and student-owned dogs visited the Iowa State University on a regular basis, and so these dogs may have been patients. A higher anxiety level is significantly associated with more frequent incidents of perioperative vomiting and nausea. Fear, anxiety, memory, anticipation, and pain are known to be higher center inputs, meaning in the brain, to the vomiting center and can elicit vomiting. These inputs to the nucleus tractus solitarius from the cerebral cortex, triggered by fear and anxiety, along with visual afferents, stimulate the emetic center directly. The influence of fear and anxiety on the incidence of perioperative nausea and vomiting in dogs has not been studied. Both the injectable formulation of maropitant given at 1 mg per kg subcutaneously 1 hour before opioid premedication and oral formulation administered at a dose of 2 mg per kg orally 2 hours before opioid administration are equally effective in preventing vomiting. In conclusion, the results of this study have indicated that the incidence of vomiting associated with hydromorphone administration in a mixed group of 40 client and staff-owned dogs from which food had been withheld was only 25%. Oral administration of maropitant at a minimum dose of 2 mg per kg prevented vomiting but not nausea when given 2 hours before hydromorphone. So there you go. Decent study, a lot of issues with it, but it's complex to get these studies done. I just wish there were more dogs involved. Thanks for supporting the channel. We'll see you again tomorrow. Bye-bye.